Hi everyone, this is Dr. Cole Handy Jones here with your Handy Physical Therapy tip of the day. Today we're talking about runner's knee, specifically IT band syndrome, and we're talking about why you should not foam roll your IT band and what you should foam roll instead. So let's get started. If you've missed my series, I've gone over two previous videos of IT band syndrome and runner's knee. One where we talk about how to assess your IT band syndrome to find the underlying cause, and then one with some exercises to fix those underlying causes. I talked briefly about why you should not be rolling your IT band syndrome. That is a very common thing that I hear from patients, that they've been to other providers who have said that before. If you have been around someone who's told you to foam roll your IT band, if you have runners in your IT band syndrome, you're around someone who doesn't really know what they're talking about. They don't understand physiology and how to truly treat it, okay? I'll briefly talk about it, but your IT band syndrome is a thick, dense connective tissue. I often compare it to a leather belt. You cannot take a leather belt and foam roll it and try to lengthen it. What you can do though, is you can foam roll the muscles that attach in to the IT band and try to lengthen those. This is usually just one small piece of the puzzle. So please look back to my previous two videos to really understand how to truly fix your IT band syndrome. Okay, so we're going to talk about what to foam roll, and I'm actually going to do this with you. So grab your foam roller, get on the floor. We're going to do a 5-minute foam roll session to hopefully help your IT band syndrome. Okay, so all you need is a foam roller. We're going to put the timer up on the screen. So pause it real quick, run and grab your foam roller, and let's do this together. The very first thing that we want to foam roll is our glute maximus. Glute maximus is one of the big muscles that attaches in to the IT band, okay? So for this one, all I want you to do is sit on your foam roller, and we're gonna roll back and forth, okay? So I'm gonna set my timer for a minute, ready, and go, okay? So in this scenario, I'm gonna give the example that my left side is the side I'm having issues with. So what I'm gonna do is lean ever so slightly onto my left button hip, and I'm just gonna roll back and forth, okay? You might find a couple knots, trigger points, spots where you don't roll quite as easily, or they're real tender. You might spend a little longer, so I've got one right there. I'm just gonna sit on it for a few seconds, slowly rock back and forth, and then keep going, okay? I'm gonna show you as we do this some of the more aggressive versions, some of the easier versions, okay? This is a little more of an easier version, okay? If this is hurting quite a bit, take a little pressure off, okay? But same thing, if you're going and you're not feeling too much, what you can actually do is take this left leg and cross it onto your right leg and lean even a little more, and that's gonna get even a little deeper in the muscle, okay? Good, and roll back and forth. Almost there, you're doing great. There's nothing wrong with doing the other side, but this side is our main priority, okay? All right, that's a minute, stop there, okay? Now what I want you to do, almost the same thing, but you're gonna roll on your side, okay? When you roll on your side, keep that affected leg down. So for me, it's my left leg, and I'm gonna cross my right side on top like this, okay? And we're gonna start in a minute right now. So for this one, you're gonna roll all the way up to the very top of your hip bone, and then you're gonna go down until you feel a pretty good bump, probably right around the top third of the thigh. There's a bony bump, and that's where this muscle actually ends. Okay, so right now we're rolling your glute medius, okay? Your glute medius is another one that helps attach into your IT band to really control your knee, okay? Remember, I gave the scenario that your IT band is like a thick leather belt. You're not gonna lengthen that. But what we can try to lengthen is the muscles that go into that. So picture taking a big thick steak, put it on your counter. You can take a tenderizer and beat that up and thin it out a little bit. You could take a roller and thin that out as well, okay? But all we're trying to do is take that muscle and lengthen it a little bit, okay? You're doing great. Got 5 more seconds, okay? 2 and 1. Good. Okay, stay in almost the same position. Okay, and this one's the weirdest one we're gonna do, okay? But now you're gonna roll and you're gonna be right on the front of your hip, okay? Now we're rolling the tensor fascia lata, or the TFL, okay? And go. Same thing, I like my right leg over the top, and all you're gonna do is you're gonna go to the very top of your hip bone, and then go down right into your hip crease, okay? This TFL, or tensor fascia lata, is probably the one that people blame the most on causing IT band syndrome. I haven't found that to be totally true, but it does have attachments into the IT band, so I think it's an important one to work, okay? You're just gonna roll back and forth. And same thing as the other ones. You might find a spot that's a little tender, so for me, I just found one right there. When I get there, I like to just kind of slowly go back and forth on it, okay, until it feels like it loosens up a little bit, and then you kind of move on, okay? I didn't choose a minute for any huge particular reason. I just think it's a nice whole round number for you to do as you're doing these. If you want to go a little shorter, like 30 seconds, or a little longer, a minute 30 to 2 minutes, that's totally okay as well. But you're just going to feel like that muscle gets a little loosened up, and then you move on, okay? Good, and that's that one. Okay, we're gonna do 2 more, okay? What we're gonna do next, we're gonna do your hamstring muscle, okay? Specifically, your bicep femoris. So your IT band's right here. The bicep femoris is just behind that right here. Sometimes you can actually feel the tendon right there. So I can feel my tendon. You can probably even see it on the screen. But I'm gonna foam roll mostly right here, okay? So I'm gonna be like this, but lean ever so slightly to that left side to bias it, okay? And we're going for a minute, okay? I like to start nice and soft, just like this, okay? You can go all the way down to where your knee's at, or you can go all the way up. The IT band actually goes all the way up to about where your butt's at, okay? And we're just gonna go back and forth. Same thing, you find a tight spot. So I found one right there. Sometimes I like to stop there, and you can actually just take your leg a little bit back and forth, okay? Just like so on it, and then move on, okay? If that's pretty easy, not feeling too many tender spots, what you can do is actually take your other leg and cross it on top of that leg to give yourself a little bit more weight. So that for me is much more tender, right about there. And same thing, we don't want to be on our IT band, okay? Although you might feel a lot of pain at the time or think it's a hurt so good, all you're doing is adding more compression to a compression injury, okay? So we don't exactly know what IT band syndrome is, but one of the big beliefs is that the IT band compresses on a fat pad that you had right here on the side of your knee, and it causes a lot of problems. Some people says that friction's over here and that causes the problems. But whatever it is, that's a minute by the way, so we're gonna stop. Whatever it is, we know it's a compression syndrome down here, and we don't want to keep over compressing that syndrome, okay? All right, the very last thing we're gonna roll now is one of your quad muscles. It's the vastus lateralis. It sits right here on the side of your quad, right next to the IT band, okay? So for this one, once again, we're gonna be back on our stomach, okay? And I'm gonna be not totally on my stomach, but a little bit on my side, kind of like this, okay? And we're gonna work up and down that quad, okay? And we're gonna start a minute right now, okay? This one for me is always my most tender spot, okay? We're gonna go up and down. You can go all the way to where your knee's at, and then all the way back up. Same thing, we're not on our IT band, right? Because we're not adding more compression to a compression injury. We're not trying to lengthen a leather belt, because that would just be silly of us. We're trying to stay on the muscle. So stay off to the side just a little bit, okay? Same thing, you find tight spots right there. I've got a really tight spot. You can hang here and just kind of go back and forth. You can also take and pull your heel towards your bottom, okay? So that really tender for me. That's about as far as I can go, okay? And we're gonna keep going. About 20 more seconds. People also ask me when they should do these. I don't think there's a right or a wrong time to do these, okay? You can do it before a run, you can do it after a run, you can do it at night before you go to bed, okay? There's not a huge difference to them, okay? Just whatever works for you that you can be consistent with, okay? And that's a minute. Good. I hope you found something of value today and that this helped. Please give this foam rolling routine a try. If you went through it once and you feel good, rewind it and go again. Pull it back up tomorrow and go through it again tomorrow. I hope this will help, okay? As always, if you found something of value, please hit the thumbs up button. It really helps me, and subscribe below. Look forward to more videos coming out for runners like you to fix runner's knee, but also other issues as well. Thanks so much. Hope to see you in the next one. Runners like you to help fix runner's knee and other problems, okay? Thanks. Should I do it again? Here, let me do it again.